Hi guys, welcome back to my channel. Today I'm going to be talking about part 2. So we're going to be talking about oily skin, so in the last video we spoke about blocked pores basically, so blackheads, whiteheads, little white pimples, and then this video we're going to be talking about the juicy ones, so the poppable juicy ones and the non-poppable juicy ones, which is a cystic acne. I'm going to call them poppable juicy ones because there's so many names: pustules, papules, pimples, acne. I mean, there are so many different names for them, but we all know what they are, right? So they're red, they sometimes have like yellow heads, and you want to pop them. So let's just go for the poppable ones. Okay, so on this video, I'm going to be talking about, why we get them, what happens in our bodies when they appear, and then also the difference between the poppable acne and the non-poppable cystic acne, because you have to treat them kind of different, and so that we don't get the scarring later on, which is a big thing with cystic acne. Trust me, I know. So we're going to go through all of that. So let's get into it. So the first thing I want to do is go through sebum. So we all have sebum on our skin. It's actually good for our skin. It's nourishing our skin. It's strengthening our hydrolipidic film. It's protecting our skin. It's super, super important. We all want it. We all need it. The issue is when we have hyperseborrhea. So hyperseborrhea is when you have too many oils, when your skin is producing too many oils, and that is what we don't want, and that's what causes all of this mess. So with the blackheads and whiteheads, there's sort of two main categories of acne, which is why I've split this video up. There's the non-infected acne, which is what we did last time and what we spoke about last time with the whiteheads and the blackheads. And then there's the infected acne, which is what we're talking about today. So the difference between the two is one is called fluent seborrhea and the other one is called seborrhea retention. Fluent seborrhea is when you are producing too many oils. So you have hyperseborrhea, but it's moving around, it's fluid, and it's moving around, it's not getting stuck anywhere. You just have an oily looking waxy skin and you just want to regulate that sebum secretion, and that's sort of what we spoke about last time. With this type of acne, which is the infected acne, this is seborrhea retention, and seborrhea retention is an amalgamation of different factors coming together. One is hyperseborrhea, so you are producing obviously too many oils. Two, you have a hyperkeratinization to the skin, and that means that you have dead skin cells sitting on the top of your skin and on the top of your pores. So basically your skin is producing more oils, and then you have dead skin over top, which is blocking the pores. It's blocking those oils in the pores. And then the third little thing left is the bacteria. So when you have infected acne, whether it be cystic or not, what is happening is that you have the oil secretion, you have that dead skin on top of the pores, and then you are also producing a bad bacteria. And with all of those three combined, that is what is causing the active acne, the inflammation, and the infection. And the reason this happens is it's called lipophilic. The bacteria, the bad bacteria that is on the skin is feeding on the hyperseborrhea, on the oils that are being produced. So it's sort of like a catch-22. You got to get rid of the dead skin, you got to regulate that sebum because you got to starve that bacteria, but you also have to kill the bacteria at the same time. So it's like all of these actions you need to be playing with and doing and working on, and that is what we are going to be talking about today, and this is the solution for that problem. And then the last thing I want to talk about is my trifecta. So what when I have customers who come in who have acne problems, and especially infected acne problems, but acne, hyperseborrhea, whatever it is, I always say that you need to adhere to the trifecta. And the trifecta is basically right at the top is you have antioxidants. You need to strengthen your skin. You need to feed the skin with all of these minerals to strengthen it, because with any sort of skin condition where your skin is unbalanced, it means that your hydrolipidic shield is also not fully functioning. So you need to replenish your skin with those vitamins and those minerals and those antioxidants to strengthen it again. So it's sort of like all part of it. It's all part of balancing the skin. So right at the top is antioxidants. Then on the left-hand side, you have hydration. It is super important to hydrate your skin. And I know that this is difficult because basically when you have an oily skin, all you want to do is strip it. You want to remove those oils. You want to have that squeaky clean feel. You just want to have those products that are just going to remove it. But the issue with that, and like I explained before, and I think I explained it a lot, but I think it's because this was something that took me a long time to get on board with and to understand. And so I feel like it's like that with a lot of people as well. I had really oily skin. I had a lot of acne, a lot of cystic acne as well around my jawline. And if anybody told me you need to add oils or hydration to my skin, I'd be like, no, thank you. Thank you, I'm going. See ya. But it's true. Because basically, if you do not hydrate your skin produces more oils. And you need to cut that cycle. That cycle needs to be cut. Hydration and oils are totally different. Hydration is water. Oils and lipids is oils. That is what is being produced. That is what we don't want much of. And so hydration is key. You need to hydrate. Also, you will age faster if you don't. It's super important to hydrate. You gotta hydrate. Hydrate. And then the third one, right on the right-hand side, is the hydrolipidic shield. So you need to strengthen that hydrolipidic shield. You need to, again, it's hydrating, regulating the sebum secretions, and also adding some healthy lipids. Healthy oils, non-comedogenic oils, very, very little oils, but you need that shield, because if you haven't got that shield, your skin, again, is just going to be unbalanced. So the whole sort of focus and our target on this skin is to balance it, to regulate the sebum secretion, to purify it, to anti-bacterialize it, deback it, kill the bacteria, to strengthen the hydrolipidic shield. I don't know if I just said that or not. And also to add antioxidants. So here we go. We're going to go through the routine, whether you have active acne with inflammation and infection, or whether you have cystic acne, it's slightly different. Now, maybe I should sort of, should I explain what the difference? I should explain what the difference is. So active acne with inflammation is when you can see a head to the acne on the top of your skin. It could be white, it could be yellow, it could be green, it could be whatever, but it's on the, you can see it, it's poppable. This is the poppable acne. It's also usually got a red ring about it, around it. That is the inflammation. So that is the infected, poppable, inflamed acne. The cystic acne feels like a bruise. It's much more painful. It's much deeper into the skin. You will not see a head. You will not see any yellow or green or white. There is none of those colors. You will just see almost like a mound on the skin. Don't pop it. Do not pop it. Please don't pop it. Don't try and put a needle through it. Don't try and mess with it. Leave it alone. And I'm going to tell you why. The majority of that bump is inflammation. So you can keep prodding at it. There's nothing that's going to come out. There's just, you're going to have to go in real deep, and you're going to get a little bit out, and then you're going to get a scar. Cystic acne produces the most amount of facial scars that I have ever seen. Whenever we see clients with ice pick scars, or when they come in for the resurfacing peels that we do at the Embassy.Of.Beauty, it is always the same story. It is always acne, cystic acne related. Don't touch it. Please don't touch it. The way to deal with it is to use really good, strong products that are going to be able to get deep inside where your fingers aren't going to be able to get to, kill it from the inside, and then it's gone. It may take a couple of weeks. You need to have patience. It's not going to be, gone overnight. But you will not be left for an acne scar on your skin forever, right? Because that's difficult to get rid of. Then you got to go through the resurfacing lasers or the resurfacing peels, and it's a mess. So just patience. Patience is not one of my virtues, so I get you. But, so the first product is the LAIT. So we spoke about this a lot now. So I think everybody knows this is like one of my favorite products. Again, it's really great for sensitive skin, but also oily skin. It is a milk. So it's a cleansing milk. It is thick. It is not like your normal gel cleanser that you are used to if you are not used to the brand. It is not going to make your skin feel squeaky, clean. It is not going to do any of that. But what it is going to do is it's going to remove all of these surface oils nicely. It's going to recondition your skin. There's no comedogenic ingredients in here whatsoever. None. This is not going to make you break out. I promise you, it is not going to make you break out. It has never made anybody break out before, and I have been working with this for 10 years. It is amazing. It is amazing. If you have infected acne or cystic acne, I always say cleanse twice in the evening, once in the morning. Use cold water. Do not use warm water. This is your first step. So cleanse twice in the evening, once in the morning, cold water. You put it on dry on your face, wash it off with the cold water. You are done. Step 1. Step 2, lotion P50W, right here. So out of the 4 lotion P50s, this one has the salicylic acid in it. So use this if you have cystic acne. I would recommend to apply this just where you have the cystic acne in the morning, and you apply this everywhere else in the evening. You don't need anything stronger. If you tend to have cystic acne absolutely everywhere, which is really rare, then you can opt for the lotion P50 Pure. You can do that. But again, I think that as I'm going to go through all the other products that I'm going to be recommending, you're going to understand why I don't recommend the lotion P50 Pure generally, because this is going to do enough of the job. You need to go in gently but strongly, and this is really the right combination of products. This is probably the skin type that we see the most of, and also the skin type that we see the most vastest of improvements on. It's always great to have somebody come in and then see them come in a month later using these products, and they are so happy. And it makes me happy as well, because I guess it's a personal thing, because I used to suffer from this. I know how they feel. I know the elation and the relief of not having this problem anymore. And it's really interesting because generally you have active acne for 2 main reasons. Generally, one is hormonal. It's always hormonal. 2 is that you're using the wrong products. You are going to be exacerbating the problem. It doesn't mean that all of a sudden by using all the right products, it's just going to poof, go away. But it's going to get a hell of a lot better. And when it gets a hell of a lot better, you get that confidence back. You get that feel-good factor back. You get that pride back. I mean, it really, I don't know about you guys, but when I had really bad skin, or how I felt about myself at that time was not great. And so I sort of really feel and understand those customers, and I get so happy when they see the results. It really does warm my heart. So yes, the next step, backtracking, next step would be the lotion P50W. If it's sunny, don't use it in the morning, because then, you know, with the pigmentation afterwards, it's just not worth it. I get that you want to get rid of your acne, but there are certain things that if you don't prevent them, you will get them later, and then it's really not, like, just be a little bit more patient. It will work. But the lotion P50W, again, it has the cider vinegar, it has the alpha hydroxy acids, it has the beta hydroxy acid, which is salicylic acid, and all of that is going to help to regulate your skin. It's going to help to kill the bacteria, because the salicylic acid kills the bacteria from the inside out. And then it also is going to help to dissolve those skin cells. We spoke about the hyperkeratinization of the skin, and this is gonna really help slough off those dead skin cells and free up those pores. So it's this really important step. All of these are really important steps. I'm gonna stop saying that they're really important steps. This is step 2. Step 2. Step 3 is the BIOMAGIC mask. So the BIOMAGIC mask it's called the red carpet mask. So basically, if you want that lifted effect before you go out in an evening, then apply this in terms of anti-aging. But I don't like to recommend it for that reason. I like to recommend it for this specific reason. So this mask contains bentonite clay and kaolin clay. And what these do is that they deeply purify the skin. So I don't believe in purifying the skin so deeply on a regular basis. So I would only recommend to use this maybe twice a week or 3 times a week. You need to be the judge, because the moment your skin starts getting tight and crispy, you need to reduce the amount of times that you're using this in an evening. Okay, and use it in the evening, don't use it in the morning. It's, again, not easy to take off the skin. You will be late for the office, or you'll be late for work, or you'll be late for wherever you're going to. You don't want to be doing that in the morning. So use it in the evening. You would apply it straight after your P50, because the P50 opens up your skin. It also dissolves those dead skin cells. So all of the products you apply after it are going to be much more efficient. So don't put this on without doing the P50 first. So it's got the kaolin clay and the bentonite, which is going to purify the skin, and it's going to bring out the oils and the impurities for the skin. And then it's got all of the antioxidants. So this is what I find, again, very useful, because we don't want to overload the skin too much with antioxidants or anything that is too active. I love to do that with a mask, because it's not left on the skin the whole day or the whole night. It's left on the skin for 15 to 20 minutes, and then you're washing it off, but you're still putting those antioxidants in your skin. And this has got amazing B5 vitamin. It's got wheat germ oil, and it's got vitamin E. So don't be worried when I say vitamin E and wheat germ oil. I could just like feel you going, I'm not putting that on my skin, it's oil, and I don't want to do that. You're washing it off. You are not going to break out from this product, I promise you. I promise you, you are not going to break out unless you're allergic, right? But from oil secretions and creating more oils, this is not going to do that. The wheat germ oil and the vitamin E are both there for the antioxidant components, but the wheat germ oil is also really good to help soften the skin. You will probably know this about your skin if you have this skin type, but your skin is probably, where you have the breakouts, it's probably feeling a little bit crispy. It's feeling it at points, and you need to soften the skin. So you're softening the skin with the cleanser. That is the first step. So it's cleansing the skin, but it's also softening the skin. And then this is your second step to soften the skin. The softer your skin is, the more the actives are gonna work and going to be able to penetrate. So it's super important, again, which is why it's part of our preparation phase. Really, really useful. It's not a must if you have active acne, but it's a great tool to add to your prescription, because it helps. It really, really does, but it's not a must. Okay, so next we have the serums. So I'm going to be recommending 2 serums. Whoa. Right here. So this is the serum extratissulaire, and then this is the complexe IRIBIOL. So you need both of them. By the way, with this prescription, you need all of the products that I'm talking about, bar the mask. You can save on the mask, but if you want this condition to get better and to clear away, it's not a can I pick, can I do this, can I do that, I'll do that later. You need the whole picture because they all have their own roles in order to balance your skin. So the first one is hydration. This is the extratissulaire. This is the lightest hydration. So this is level 1 of hydration that Biologique Recherche do. It feels like water on the skin. You will not break out from this. This is very, very lightly hydrating, and what it does compared to and contrary to the other hydrating serums that we have, which is the serum amniotic and the serum colostrum, is that this works on keeping the hydration within your skin as opposed to adding so much hydration in. So this has pink laurel, which is really pretty. It's a really pretty flower that grows in Switzerland, and it grows like in the mountains. And basically, it's really hardy, and it has, I don't know, evolution or whatever. I'm not great with nature, but it has learned to, because there's not much water up there, I guess. I don't really know. I would have thought there was water in there. But anyway, we're told there's not much water coming down from there. And in the Swiss Alps, that all of a sudden really doesn't make sense to me. But anyway, this plant has apparently mastered the fact of retaining moisture, retaining hydration, retaining the water, and therefore not needing for it to snow or rain so much. Maybe it's in the summer. I don't know. But anyway, this is what is contained within here. It's very light. It's not oily at all. It's not going to help make you break out, but it is a must, because remember what I said before about you need to add hydration, otherwise your skin is going to produce more oils. Hydration is always key no matter what type of skin you have, especially when you have a specific skin condition like this though, you need to hydrate. So extratissulaire is a must. It also has moisturizing plant sugars, which pretty much do the same thing. It helps the transepidermal water loss, it helps your barrier, and we're all about doing that when we have acne. So this is the one that we would recommend in that instance. And then the other serum I would recommend is this one right here. So this is the Complexe IRIBIOL. Guys, this is strong. This is a target serum. Don't put this everywhere on your face. You can put the serum extratissulaire absolutely everywhere, even under your eyes. It's been ophthalmologically tested. So you apply this first and you apply it absolutely everywhere on your face, your neck, your chest if you want to. It's really good. This one, opposite. This one you apply just where you have your active acne. Don't apply it everywhere. Please don't apply it everywhere. This is very, very strong. So this has salicylic acid in it in quite a high amount, which is why I said previously, you don't need the lotion P50 because this is better. It is better. It's gonna work better to kill the, especially the cystic acne, the one that you can't get to with your fingers and your, the pushing and the pumping and all of that action. This is going to get to where your fingers can't get to. So this has the zinc and it has the salicylic acid, and it also has iris, which is anti-bacterial, antimicrobial. So this is your like total solution to acne. It really, really is. It's to active acne and especially to cystic acne. So this is going to be anti-inflammatory, it is going to be antibacterial. Only apply it in the evening and only apply it on your acne. Super important to know that. Okay, And then we have the creams. So the creams separates a little bit at this point. So if you have active acne and not cystic acne, I would recommend the CREME ISO-PLACENTA. So the CREME ISO-PLACENTA is to be used in the daytime. This is the new formulation. This is now vegan. It is no more from pork. I think it was pig cells secreted from the placental proteins, I think, but it was a byproduct anyway. It wasn't like it was a byproduct. But this is totally vegan, and it's again biomimetic. So they have taken the protein from the placental cell from the pig, and they have basically mimicked it, which is why it's called biomimetic. They've cloned it. They've cloned it. So this is really important because it's sort of doing two things at the same time. It's going to purify your skin. It's going to sebum regulate your skin. It's got antioxidants, but it's also going to start to repair your skin. So when you have acne, you also have post-acne pigmentation. I'm going to talk about that much more in depth in the next video, which I'm really excited about. But you already kind of can start doing that right from the get-go, because why not, right? Kill two birds with one stone. So in terms of ingredients, we have the Centella asiatica, which is again was in the Creme Collagen Marine, and this is purifying, it's antioxidant, and it's soothing as well. So it's really nice to put on the skin. Then it obviously has the yeast extract because it's brown. Let me show you. So I have this one. In terms of texture, it kind of is like that. So it's a brown cream. It stinks. I should tell you that. It doesn't smell good. It doesn't smell good, but it really works. It really works. It's one of the stinkos, but it's good. It's good. And then it has the vitamin C in there. So again, it's good for strengthening your skin. It's got a very, very small amount of it, so it's not gonna be overreactive to your skin. But vitamin C is always very important as an antioxidant, but also to brighten the skin. When we have an oily skin, it tends to be dull because we have all of these dead skin cells over the top of it. So it's always really good to help to brighten and illuminate the skin. And then lastly, really importantly, we have vitamin B3. So the vitamin B3 is going to help with the transepidermal water loss. It's going to help with the anti-inflammatory because we have inflammation in our skin when we have active acne. It's antibacterial and it's purifying. So again, this has been reformulated to be a total solution to that sort of, oh my God, that really itches. All of a sudden my foot just crazily started itching. Oh my God, that was crazy. Did I get stung? I got stung. No, I didn't get stung. I'm good. I'm just crazy. What was I talking about? Vitamin B3. Yeah, great ingredient. It's renewing, it's purifying, it's antioxidant, it is antibacterial, and it's anti-inflammatory, and it also helps with the transepidermal water loss. Tool. I wish I could just say tool. It would be so much easier. But that's a great one. For that, if you have cystic acne, you would use this in the morning and in the evening. Okay? This is really important. Use it morning and evening. If you don't have cystic acne and you have active acne, which is not cystic, you have a head, you can use the crème dermopurifiante in the evening. Now the crème dermopurifiante is a bit of a wild cream. It is there to purge your skin. Only use it in the evening for the reasons that follow. A, it contains acids, so you don't want to be using that during the day. Two, its main focus is to pull out your oils to the forefront and to purify your skin. So you put it on in the evening, you will wake up with oil on your skin. So you don't really want to be doing that in the morning because you put it on in the morning, you do your makeup, you go out, you do whatever you're doing, and a few hours later you will be super oily. You will be super oily. Plus you have the hydroxy acids in there, so if there's any sun, not that we're seeing any sun in the UK at the moment. We're nearly in June. We're nearly in June. Give me some sun. Jeez. So it's a the crème dermopurifiante is a really complex formula. So it has lots and lots of actives within it. I never recommend it to cystic acne just because it brings everything to the forefront. And when you have cystic acne, there's no hole, there's no head. So basically it's just pushing it out and it just hurts and it just goes a little bit crazy. In some cases it even gets worse. So I don't recommend it to cystic acne. If you have cystic acne, please don't use the crème dermopurifiante. It's not a good idea. It's not a good idea. So in terms of ingredients, we have the rosehip extract in the crème dermopurifiante, and that reduces sebaceous secretions, and it also tightens pores. It also has the Centella asiatica, which we all know purifies the skin. And then it also has the yeast extract, which is there to balance the skin. It has hydroxy acids, which helps to exfoliate the skin, remove the dead skin, free up the pores. Really important. And then it has the vitamin B3 and the mimosa, which are also purifying ingredients and purging ingredients. So the main focus of the crème dermopurifiante is exactly in its name. So crème is cream, obviously in French, and dermo is skin, and purifiante is purifying. But it should be crème dermo-purging. I mean, if I could rename the product, I would call it crème dermo-purging, because it purges. It comes out, it's out, you need to wash it off. The first thing you do when you wake up in the morning is you get your LAIT and you cleanse. If you feel like you need to double cleanse. It's not a problem. But that is a really good cream if you don't have cystic acne and you have more of an all-over acne situation, active acne situation. If you have a few here and there, I think it's a little bit much to go with the crème dermopurifiante because it's a pretty heavy treatment. I think you'd probably be able to get away with using the CREME ISO-PLACENTA day and night. But I always say to my customers, those who I think can get away with the crème dermopurifiante, you know, get all the products that you need and, you know, use them for a couple of weeks. And if you're not seeing the results that you want to see within a couple of weeks, then you can always add the crème dermopurifiante later, because it's all the same products, right? The only difference is your one cream. So you would use, if you're using the crème dermopurifiante, you would use the ISO-PLACENTA in the morning, and then you would use the crème dermopurifiante at night. Otherwise, the rest of the routine is exactly the same. It does not change, it's the same. Okay, that is it for this video. On the next video, we are going to be talking about post-acne pigmentation and how to improve that. We're going to go through that on the next video in a couple of weeks. So guys, thank you for watching this video. Please subscribe, ding the bell to be reminded for the next video, and leave me comments. I always love to hear from you guys. I read every single one of your comments and I love it. Really enjoying this. So I hope to see you on the next video. Do your skincare, it makes you happy, and I'll see you soon. Bye.